Preeti and you're watching Med Resolution. In this video, you will be learning the RS questions of bones of the upper limb. That is, first question will be the peculiarities of clavicle. I'll be seeing the length of the video and I'll be continuing the remaining questions in the next video. First question will be the peculiarities of the clavicle. This is the only long bone which is horizontally placed. As you can see here, all other long bones like humerus, radius and ulna. This lateral side will be the radius. This thumb side. The thumb side, this is the radius and this is the ulna, and femur, tibia, and this is the tibia, this is fibula. All these long bones which are vertically placed, or the only long bone which is horizontally placed is the clavicle. If we have to say that it is a long bone, it should have two ends like this and one shaft. Even these bones, this metacarpal bones are called miniature long bones. They are one of the type of the long bone which has base and the one hand. And so this is the only long bone which is horizontally placed, and it has no medullary cavity. All long bones will have medullary cavity like this, where blood is synthesis, like erythropoiesis will take place in this cavity. In red bone marrow, erythropoiesis will take place. After that, it will be converted into yellow bone marrow, where that it does not blood production doesn't take place, and it is subcutaneous throat. As you can see, this is subcutaneous throat. We can touch here and feel throat is length. It is subcutaneous. And the other feature is it is the first bone to ossify. That is, in intrauterine life, when the baby is in the mother womb, only 5th to 6th week it ossifies. It is the first bone to ossify, and it is the last to complete ossification. It takes 25 years to ossify, to complete its ossification. It has two centers of primary centers of ossification. Primary center means that is formed before the birth. That center that forms before the birth. If you see the children's X-ray, you won't see any bony bony imposition in the ends of the bones. So it simplifies that the bone does not fuse, that the bone formation at the ends does not takes place. This is the only long bone which has two centers of ossification, two primary centers of ossification. Primary center is a center which ossified before the birth. As the law of ossification says, this is ossified before the birth. It has two centers of ossification. It is the only long bone which ossifies through membranous. All other long bone ossify through the cartilaginous ossification, but it is the only long bone which ossify through the membrane, except the sternal hand. This has two hands. This is the sternal hand towards the sternum, and this is the clavicular hand. This is the acromial hand, which is towards the acromial process of the scapula. So this is the sternal hand. This is the only hand which ossifies through this is a medial hand or sternal hand. This is a lateral hand or acromial hand. This is the only end which ossifies through the cartilaginous. The entire this clavicle ossifies through the membrane. So this is other exception. And it is pierced by the nerves. As you can see in this image, it is pierced by the nerves. Many nerves passes near the clavicle, and brachial plexus even passes under this clavicle. So it is pierced by the nerves. That's all for this video. Thank you.